Hello, how are you?
Good to meet you.
Good to
I'm
meet
Laura.
you. Laura, hi, Will. Great to talk to you today. Well, okay, Laura, first of all, thanks for meeting with me today. So I told everybody this morning I did a video, and I think the coolest part of what we're doing on this Washington, D.C. trip is I'm stopping along the way to talk to people that are in agriculture, to talk to people that are really plugged into serious healthcare issues that need help, and then I'm talking to teachers and educators along the way too. So you're my first stop. You're my first stop. I wanted to just start out. I think it's really important that everybody just understand the situation that your family is in and why the healthcare issue is so critical and important to you. So if you want, just kind of walk us through what you're experiencing from a family perspective, and then the shock that you received when you pulled up your portal this time to register for the ACA. I got a shock. A lot of people are emailing me and telling me they got a big shock, and it sounds like you did too. Why don't you just tell us a little bit about the background?
So I'm self-employed. My husband is a carpenter. He works in St. Louis, but his employer doesn't offer health insurance. We have 3 kids. 2 are adults, and our youngest is a senior in high school. We've relied on the ACA for years. It's been a great resource for us because we're able to work our jobs and know that we have health insurance. And this year, when I pulled up the premium, I was shocked. It's really unaffordable, and I don't know what we're going to do.
I wanted to say one thing that a lot of people I think don't understand about the ACA. It's the primary source of insurance for people that are self-employed.
Yes.
Especially in rural America, because there are a lot of farmers. Like, everybody thinks, well, a farmer is just married to somebody that has a full-time job and they get their insurance that way. But in reality, even a lot of spouses of farmers are self-employed as well. Maybe they've got a boutique shop, or they're doing something else that's self-employment. It's the number one way we get insurance out there. Do you mind sharing what your premium jumped from, what you were paying before, and what it showed on the exchange you would pay now?
We were paying $310 this year, and with just a slight bump in income, it looks like it's going to be around $1,300 a month.
Well, it's just $1,000 a month, can't you? So $12,000 a year increase because the ACA tax credits are going away.
Yes.
And just to explain to everyone that's watching the video, the way it works out there is these ACA tax credits were put in place when the Affordable Care Act was passed, so that depending on your income level, you'd get a tax credit that was applied immediately to your premium. And then at the end of the year, the way the government does it is if you make less than what you thought you were going to make, you get a credit on your tax returns. If you make more, maybe they charge you a little bit on your tax returns. During COVID-19, the federal government stepped in and said, okay, we're in a crisis right now, so let's increase the amount of tax credits that we're given. And then in rural America, depending on whether or not the federal government classifies you as living in rural America, we get an additional 27% tax credit because our insurance plans are so much more expensive out here.
Yes.
Because we have fewer options and fewer places to go, and it's just more expensive to get health care in rural America. So what we're in danger of losing are all the additional ACA tax credits that we got during COVID-19, plus the 27% tax increase that was put in place because we live in rural America. And I wonder, let's just say worst case scenario, and we all hope that this doesn't happen, but worst case scenario, let's just say it's an extra $12,000 a year and nothing happens to give you relief from that. What's that mean for you and your family?
I don't know. we have an 18-year-old daughter who is a senior in high school. She's a good student. She's planning on going to college next year. We've just now reached the federal poverty level cliff for the ACA. So we've been working our way up this year. So we don't have, through the years, so we don't have substantial savings, but with the credits in place, we were hopefully going to be able to assist her with her college expenses.
Yeah.
Definitely won't be any more family vacations. I don't know whether I should keep contributing to my retirement account, or, I mean, we've sort of tossed around the idea of maybe going without health insurance this year.
And that's dangerous for any family to do. I told you before we started the interview that I'm seeing about a doubling of my premium cost. And I think the decision or the conclusion that I've reached is I may have to go, even though I've got some health issues that require regular maintenance, I may have to look at going from a gold plan down to a bronze plan and paying a lot more, out of pocket to do that. But I want to dig into what you said, because those are some really serious ramifications. So here you have your family, and you've done everything we ask people to do from the perspective of self-betterment, the old pull yourself up by your bootstraps. So your husband's got a great job in the trades, but no health insurance. And then here you've gone out and you've become self-employed. And do you mind telling everybody again what you do?
I'm a self-employed house cleaner and caregiver.
Yeah, caregiver. All right. I just wanted to get that out there, because I think a lot of people are going to be like me. My mom had a really serious stroke in 2017, and I can tell you that a caregiver becomes like a member of the family. This is the person you're entrusting your relatives with. Once you find somebody that does a phenomenal job and that your parent or grandparent really likes, you don't want to get rid of that person. Your husband's got a great job. You've gone out and you found a great job doing really good work that contributes back to society. And now, because these credits are going away, you tell me if I'm getting anything wrong here. Number one, you've got to make the tough decision, or we're going to be able to help our daughter pay for college. What happens if you can't? Is there a chance that she may not be able to go, or she'd have to wait?
I mean, things would definitely have to be put on pause for a while. Maybe she would take out loans.
Yeah, and that creates a whole nother scenario, right?
Yes.
In the long term. I mean, my kids still have student loans that they're paying off, and I've got friends that are my age in their 50s that are still paying on student loans they got when they were 22.
No, and we've been fortunate enough that her father and I didn't have student loans.
Yeah.
So we really don't want her to have to deal with that as she goes into adult life. We want to minimize that as much as possible for her.
Yeah. And then you said the other choice is you're trying to save for retirement right now.
Yes.
Which they tell us we're supposed to do.
Yes.
And, we send our kids to college if they want to go, and we get a retirement plan set up. So the second tough choice is, do you not save for retirement?
Right. And I don't know if I can clean houses until I'm 80. That's always a joke that I make.
I can't I have somebody clean mine now. I mean, you reach a certain age where it's not so easy to get down on the ground and do that hard work.
Well, my husband's a carpenter,
Yeah.
and he likes to say he's going to work forever, but he's probably not going to.
Do you mind, and only do this if you feel comfortable, but like, what are some of the needs that your family has in terms of medical care? Is it all like regular family issues, like just when people get sick, or if something came along? Do you have any special needs issues where you require like regular healthcare maintenance or that kind of thing?
Fortunately, no.
Yeah.
So we've used the ACA as an insurance plan. That's what it's supposed to be. We go for our annual physicals, we get our labs, our annual mammograms. Every once in a while we need urgent care for strep throat or whatever. But other than that, we just treat insurance like it's supposed to be. In case something catastrophic or terrible happens to your family, you don't want to go bankrupt.
So let's talk about that for a second. That's the option for your family then, right? If you have to make the decision not to get insured because you can't afford the premiums, and something catastrophic does happen, God forbid, you always hope it doesn't. But I didn't think I was going to break my foot and my knee when I stepped off those stairs at my brother's farm the other day.
Yeah.
What would that mean for you if you had something serious that happened and had really catastrophic bills?
It would bankrupt us. Like I said, we've slowly been sort of working our way up, and we just sort of arrived right here at finally at a comfortable middle class income. And if we had an uninsured hospital bill, that would bankrupt us.
Yeah, a lot of people are in the same boat. We do lives regularly where people can come in and share their personal experiences, and we just hear that all the time. I'm going to get into in a minute what you want to see our elected officials do, but I'd like to ask you just kind of a personal question. How does it make you feel right now that healthcare is kind of being used as this political pawn, hot potato being bounced back and forth amongst our elected officials? As you're facing these issues like, can I send my daughter to college? Am I going to be able to save for my retirement? If we don't get insurance and we have a serious problem, it could bankrupt us. How do you personally feel about what's happening right now with the ACA credits and these changes we've seen?
It's really upsetting because we've done everything that we're supposed to do. Like you said, we both work and we have paid our share of our insurance premiums, and to just arrive at a healthcare cliff that suddenly says, you know, you're going to have to pay $12,000 extra a year in insurance premiums it's upsetting. I
mean, I felt it just with the increases that I faced, and then the extra worry that it adds, you know. And I know if I had kids now and I was making a determination, well, do I let them play this school sport, or do I let them go on this trip, or, you know, even the simple decisions that you make when you're a parent, I would be thinking in the back of my mind, well, what happens? There's risk involved, you know, in everything we let our kids do. And how would it impact us as a family? Just things that you normally wouldn't have to think about because of these changes. Healthcare is one of those issues that shouldn't be Democratic or Republican or independent. Like politics, it seems to me anyway, shouldn't even come into play. I tell people when I was 12 years old, I had a really bad farm accident. And I got my left arm caught in the power takeoff on a tractor. And I laid out there for 2 hours waiting for an ambulance to show up on our farm. And you know, it's funny, not one step of the way, while I was laying there, while my grandparents were with me, when the ambulance showed up, when I got to the emergency room, after I had surgery, when I went through rehab, all these other things, nobody ever asked me if I was a Democrat or a Republican or an independent. It just wasn't important at the time. So I want to ask you, what do you want to see our elected officials do to fix this? In the perfect case scenario, if they were doing the job the way they're supposed to do it, what would that look like to you?
The healthcare cliff is really terrible. It's going to impact so many people, my family included. I think in the meantime, my opinion is, could we not reinstate the previous credits and then legitimately work on actual healthcare reform? It doesn't seem like it's a partisan issue to me. You can't leave millions of people potentially uninsured. The subsidies go up, and then they just fall off. It just naturally could go up and then just slightly decline, and then get together and work on reforming the things that actually make healthcare and health insurance so expensive.
Right. I read an article the other day that says we spend, in many cases, as much as 2 to 3 times more just on the healthcare, not the premiums or the insurance, but on the healthcare we provide in this country, and the outcomes aren't as good as some of the countries that are spending half as much, which that's really disappointing, and it needs to be addressed. But, you know, one of the things that people say, let me ask you this question. So one of the things that people say is they're like, well, the ACA doesn't work great, it's broken, all these other things. But my personal experience on the ACA has been really good over the years. I started taking advantage of it 2 years after it was established, and my personal experience with it has been really good in terms of being able to get the health care that I need at an affordable rate. The only bump in the road I ever ran into is in my state of Missouri. They made it okay for the healthcare plans there not to cover you when you were outside of the state. So I had to have something done at Mayo Clinic and it wasn't covered. I had to pay for it out of pocket. For you, what's your experience been like on the Affordable Care Act for you and your family? Has it worked the way it was supposed to? Has it met your expectations?
Oh, it's worked great. We live right here on the border of Illinois and Missouri, so I'm actually able to utilize healthcare in St. Louis or over here.
Oh, so you can go to Barnes.
I can.
Yeah, that's phenomenal. For everyone that doesn't know, Barnes is like the regional incredibly good. They're the ones that did my fusion that make me like Frankenstein now.
I use a federally qualified health center for my primary care, and they're phenomenal about making sure that everything's in network. All of the referrals that I've for a mammogram or lab work, it's all been in network and covered, and I've never had any unexpected expenses.
So for you, the Affordable Care Act has been really good. It's worked exactly the way, you know, because politicians like to talk about all these horror stories, but then they never give an example. it's like this generic condemnation. And I'm like, well, I've never had anything bad happen on the ACA, and it's worked exactly the way, I take advantage of the dental and the vision and the healthcare. I want to go back for just 1 second to your daughter who would be in college. Another, I think, great feature of the ACA is that it allowed you to keep your children on your healthcare all the way through to the age of 26. And that allowed my kids to get through school and get out and get established on their own. And then it was a great option for a couple of them to get their own insurance once they, went out from underneath that umbrella on my insurance. Do you see that part of it being a big advantage if your daughter does go to school and you're able to keep her covered during the time she's there?
No, it's super reassuring to know that she's gonna have insurance while she goes to college. Our oldest child is on his own ACA plan right now, and that's working just as well for him. It's really important to us.
Yeah. When you've reached out to your politicians, whether it's local or your congressperson or senator or that type of thing, how responsive have they been in working with you to try to address the issue? Do you feel like the people that you elected to office are listening?
Representative Bazinski is our congressional representative here, and when I first read that health insurance premiums were going to increase, I got up one morning and I said, you know what, I need to say something. So I sent literally a 2-line email saying, my name is Laura, I'm self-employed, my husband doesn't have health insurance available through his employer. If these subsidies expire, we will not be able to afford insurance. And I hit send, and I went to work and I went about my day. And I was astonished at the response that I received. Her staffer immediately reached out, gave me his personal cell phone number, asked if I could give him a call. A quick call, he said, a quick chat. So I got off work and I got in my car and I was prepared for, just a brief rundown. And I looked at the phone when the conversation was over, and he had been on the phone with me for 21 minutes, and then reached out again for a roundtable with our representative. And then he followed up and said, I hope you're well and I hope everything's okay. And I just, for somebody who's never really, I vote, but I've never really participated actively in politics, I was really pleasantly surprised by her reaction.
No, that's great, because a lot of people, the experience I'm hearing from a lot of people is they're not getting any call back. So that's great that you received that kind of experience. Let's forget about addressing this question at any particular person, but let's say you were sitting in the well of the House of Representatives right now, and maybe it's a State of the Union address, and you had all the elected representatives, all of the senators, the president, the vice president, just everyone's in the room. If I were to ask you the question, what would you say to them about where this is going to put your family, et cetera, if these ACA credits aren't restored? What would you tell them in terms of, this is how it's going to impact me and here's what I want you to do?
This is going to completely alter the course of our life. There's no way around it. $12,000 for a family, a middle-class family. Something has to be done. The subsidies can't completely expire. If they don't like paying the subsidies, reform the healthcare system. Get in there and make some reforms. But for now, you can't just end a program. You can't just end a program that so many people rely on. We're real people. We work for a living. We have families.
I think that's great. And I'm going to take your story with me if you don't mind. I'm going to be in Washington, D.C. for 2 weeks. We're going to be meeting with elected officials. We're going to be telling stories. We're going to put your video on social media so people can hear about your family and the experience that you've had. But I'm going to promise you something. We're going to take your story to Washington, D.C., and we're going to advocate for you and hundreds and thousands of other people out there that are in the same boat, including me. And we'll do everything we can to make your case and hopefully change some minds while we're there.
I appreciate it.
No, you bet. It's great to meet you.
Thank you.